St. Francis Healthcare Services, in partnership with the Uganda Network of Young People Living with HIV, organized the Eastern Regional Symposium for Adolescents and Young People Living with HIV from September 9th to 11th, 2025 in Jinja.
My name is Nyanzu Zairu. I'm Youth Coordinator at St. Francis Healthcare Services in Jeru. First of all, we are very happy that today we have been able to have a successful third edition of the Adolescent and Young Person Living with HIV Regional Symposium.
My name, I'm called Alfred Judokaje. I'm a Stepping Stones trainer. Stepping Stones, we're implementing Stepping Stones with the children and their caregivers in Mbale and also in Iganga and part of Kampala. Right now here we are in a symposium, young adolescent and young people living with HIV symposium. It's an opportunity which brings young people living with HIV to share their passionate experiences and to share some of their challenges in the era of uptaking medicine and all challenges that are affecting them as children and as adolescents living with HIV.
In Atandikro Kuma, when I have 13 years, that is the age where they disclose. In Amanya, Nemanya Chendi, Rachi Mire Dagara, or Nintandikachi, Kumajuka Nais to Mira Sukura, Brunga Dagasaga, Nadimira, Nasagara. Ngose nebera mu byange mukuzanisa neza cyusenga sefi rayo angamba akasajja kakanyive ninganzemira akasajja kabera kanyive eva ngamba bikasera enze mbere wa kansala bwe kimu kibyakunza atenze nazaki musango gwaki.
The idea of the symposium came when we realized that for so many years young people living with HIV from our region, specifically the Eastern region, we were struggling to make an impact in our communities, struggling to make an impact in our districts where we come from, but also to transit from our district and make an impact even at the national level. And on top of that, we have been having issues within our communities, issues like stigma, where our parents are still regarding us as curses, where our parents are still taking us as burdens, who are still sidelines, even in attending events, even going to school. Some parents still don't allow us to go to school. So we lacked that voice, we lacked that proper voice as young people living with HIV.
My name's Kalume Saidi. I work with Jinja City as a senior health educator, as well as HIV/AIDS focal person. According to the Uganda AIDS Commission report of 2024, we were ranked at 7.5% HIV prevalence rate. As youth and adolescents, this is a very delicate age in life, and some of them, they need serious counseling and guidance from the parents. Parents, we need to talk to these youth and advise them. We shouldn't get tired from time to time.
Nali manyi edda nga manyi nti omuntu alina sirimu n'omusembera batishi akukwata. Naye engeri gyengenze nembeera ku St. Francis, sister wange yantwala ku St. Francis. Naye nga era nga ntya nga ngamba banante bankwase sirimu bishi kati we nategeera like wetuddeko mu sessions nga tuli fenna tunyumya n'okulya esowani oli gyaliddemu nange nsobola ogiriiramu. Kati saa zino njagala nnyo okubeera n'abantu abo kubanga nabo ndabanga bantu tweyagala like nabo bantu.
The symposium makes sure that young people living with HIV get an opportunity to share experiences from other persons who are coming from different districts.
My name is Ruth Akulu. I represent the youth on the Uganda Country Coordinating Mechanism Board for Global Fund. I've been a leader for the past 6 years in HIV space, and these are the 3 things that have helped me, and these are the things that I've also shared with the young people in the room. One is being humble, because we are still young and growing, so humility should be our utmost value to being a good leader, especially to our peers. Secondly, willingness to learn. As young people, we are also always learning. There are always new developments in health.
We know there is reduced funding, across the NGO, even the government of Uganda. Most of its funds have cut off the funding. And everyone now is calling for integration of services. And the government has sent out so many opportunities. For example, they have sent out money for development, like Myoga, the parish development model. But our young people, specifically living with HIV, they have not benefited from this money because of the other issues I talked about, the stigma. They don't know who to go to, how to approach them. So we felt, no, we need to invite the key stakeholders in some of these programs to answer the questions.
Leaders, we need to have numerous engagements with these youth. We shouldn't leave them just to go to ghettos and we think they are independent. We need also to involve them in the planning. What do they need? If they need football, if they need netball, if they need indoor games, it's our responsibility to ensure that we keep them busy, having things which will not take them to issues that can affect their health. We need also to ensure that we work hand in hand with our nearby facilities for advice on health-related issues among the youth, to set up youth-friendly corners in each and every facility.
In terms of health, as they call for transitioning, as they call for integration, young people are left in spaces. They don't know how to go about this. We felt like we need to talk about that as well, to better understand how young people are going to be also part and parcel of the integration process, not as beneficiary, but also as stakeholders engaged fully.
Now is the time for young people living with HIV to become leaders, because without treatment, without determining or influencing policies that affect us, we will be at loss.
Mulamu, so that never did a bogama if not to be balamu bakulama nti nawe oyogolozaamu ki amaanyi. Then ekirala nga bano abasigadde bagambye nti education skill set weeweeyo okulaba nti oyiga ebintu ebipya.
Batuyigiriza ku business, batuyigiriza ku stigma, nemanya stigma sheshi, self stigma, community stigma.
I learned about strategic leaderships. So by then I wasn't knowing that leadership, you can okwetega in any opportunity, no matter no fune ekyo kyennyini kyobadde oyagala naye ng'obadde tonatandika kifuna naye nakitegedde nti no si buli mukisa tugenda kusangawo otudde egimu tulina ogyetega. Nze wentuuse symposium esatu ze nankabeeramu zinfudde omuntu ow'enjawulo ku balala.
Today the whole thing is about how you pitch yourself, how you address your issues. And one of the things that has been impeding us, or that has been limiting us from, going through all the levels up to national level, is failing to understand how we approach certain things. So we are here today still to support our young people from our region to understand how to go about different things, how to position themselves, how to communicate delicate issues and what we call the taboos in our communities, how to communicate them very well such that the right people understand them without bias. In a nutshell, that's how the symposium came to happen.
I am Paul Mwanje, the Director of Program St. Francis Healthcare Services. One of the reasons why we have success in this year's symposium, one is from our partner, Stephen Lewis Foundation, and our partners who have facilitated the bringing of the youth under their care to participate in the symposium. But secondly, also the implementing team of St. Francis for taking, because it has taken us time to plan the content of the the symposium and also gather guest speakers who would participate in the symposium. So in a special way, special thanks to the team. In the next 5 years, we are hoping to bring on board more partners because, like I said, the partners are growing year by year. So in the next 5 years, we are hoping to broaden this to include even partners from the central region, because currently we are focusing so much on partners in the eastern region of Uganda. But in the coming years, we are hoping to increase the coverage to the central region.
The 2025 symposium was organized by St. Francis Healthcare Services and Stephen Lewis Foundation in partnership with Ginger Network of Young People Living with HIV/AIDS.